Next up is active learning from now until about 10:05. Our moderator will be Lloyd Novick, the editor-in-chief of the Journal of Public Health Management and Practice. Lloyd has had a very hybrid career of academia and practice as well. He's professor emeritus. He's the founding editor of the Journal of Public Health Management and Practice and continues as editor-in-chief. He's professor emeritus at the Brody School of Medicine at East Carolina University, where he was professor and chair of the Department of Public Health at the Brody School of Medicine between 2005 and 2014, and he has served as the Commissioner of Health and the Secretary for Human Services of Vermont, Director of Health Services for Arizona, and Director of the Office of Public Health for New York State. So he's bounced around a lot, and now he's here. Thank you.
I'd like to invite the members of the panel to come up. David, Nancy, Janice. So we're staying right on schedule. This is a panel on active learning, and active learning goes right to the heart of what we're talking about today, being very important for the education of our students. I'd like to introduce the panel. David Kleinbaum is Professor Emeritus of Epidemiology and Biostatistics at the Rollins School of Public Health, Emory University. Prior to that, he spent 20 years at the University of North Carolina, teaching epidemiology and biostatistics. His interests focus on modeling in biostatistics and epidemiology, and as I learned last night, North Carolina basketball. He has completed a multimedia electronic textbook on epidemiologic methods called Active Epi Web. It is available to anyone, anywhere in the world, at no charge, and it currently has more than 9,500 users. Nancy Kane is Professor of Management and co-chair of the Task Force of Educational Quality at the Harvard T.T. Chan School of Public Health, where she is a professor of management in the Department of Health Policy and Management. She directs the Masters in Healthcare Management program, which is an executive healthcare program created for mid-career physicians leading healthcare organizations. She's known for her work in case-based teaching and has founded and leads the Center for Case-Based Learning. She was a member of the Medicare Advisory Commission, advising the U.S. Congress on the Medicare program. Jacey is Clinical Assistant Professor of Community Health Sciences at the Boston University School of Public Health. She teaches courses in behavioral theory, intervention planning, and evaluation. She has done extensive work in evaluation of public health programs in the United States, particularly those in underserved areas, concentrating on programs in obesity and also behavioral problems. And our fourth panelist is Dr. James Wolff, who's an associate professor of global health at Boston University School of Public Health. He teaches maternal and child health and also teaches mobile technologies to improve health outcomes. He's worked with the Boston University School of Public Health programs in India. He is a practicing physician, board certified in emergency medicine, pediatrics, and preventive medicine. In 2007, he won the Clinician of the Year Award from the Massachusetts Medical Society. We will start with Dr. Kleinbaum.
Good morning. Let's see. You notice something. In order to talk about active learning, we have to start being active. Okay. Another way to be active is this way. Okay. I'm known for my shirts, as some people know. Okay. So, what do we mean by active learning? It's very simply, it's a teaching approach that strives to more directly get students to participate in the learning process rather than to be passively learning. And saying a few more, ooh, I skipped something. Something got skipped. But anyhow, here's a picture. Distinguish passive from active learning. Which is which? I'll let you figure that out. Okay. Going on, the learning process, when you're talking about active learning, the learning process is typically enhanced if students read, write, and discuss, are engaged in solving problems as well as enjoy and at least appreciate the learning experience. Okay. And lastly, it's important to say that how it is taught is as important as what is taught. Okay, so I'm basically going to talk about 4 general learning approaches to active learning, and I'm not necessarily covering everything, but this is from a perspective of my background is teaching biostatistics and epidemiology for a long career of 48 years, and it doesn't deal with teaching a course in like infectious disease or cancer or something like that. So I may have missed something in listing these things. So the first thing is, and this is very important, and one of your other speakers is certainly going to talk about it because it's on their agenda too, is to create a relaxed, friendly classroom environment that positively influences student motivation for taking and remaining in the course. Now, that's really important, that if you're talking about active learning, you want your students to be feeling like they want to be there. And particularly this is true for statistics courses that I know from way back when. They didn't want to be there. They hated it. They didn't want to, but it doesn't necessarily is restricted to that. So you really want them to be there, and you want to do things to make them, want to be in the class. And among the things you could do, first thing on the list is make a positive first impression by trying to learn the students' names. I don't know how many of you do that. I know Regina West does that, and she's known for doing that, and I've been doing that for years, and it's not that easy to do, especially when you have a class of 150 students. But it's very important. It really helps to stimulate the class because they realize they think you know something about them. And you're interested in it. So that's one thing. Another thing is to be friendly, humorous, and receptive to questions in and out of the classroom. And of course, among these things, everything is important on that list, but humor is not an easy thing to do to bring into the classroom. And I happen to be, over the years, learned to do that to some extent because of my personality or my background, Brooklyn background. But it's very important to put humor in and to do it in such a way that you're not just telling jokes, you're putting it in something about yourself, something about how it relates to the class or what you're teaching, or even if you make a face at the class or yell at the class, something works like that. Okay. Another thing is learn to improvise during the lecture. As Lloyd did not mention, one of my sidelines is I'm a jazz flutist. And so I improvise. I learn to improvise. Now, that's very important in teaching too, because when the class looks like things are slowing down, things aren't going right, you have to learn to change how you do things in the class. Not only what you say, but how you motivate the class. And lastly on this list here is, if I can get it, be conscious of using clear, simple communication. And I mentioned that primarily to say that you want to make sure that when you talk to your students, you're approaching how to communicate to the students, not communicate to other faculty, so they feel like they understand. You want the students to understand, so you make it simple enough for the students, or make it understandable enough for the students. Okay, that's the first thing. Second item, didn't come up. Come up. Oh, okay. Create alternative approaches to teaching a class rather than using standard lecture format. And I know a lot of you do that. I just want to list some of them, okay, that alternatives just to standing up. And not to say that standing up in the standard lecture format is bad, but you have to be good at it in order to make it work. And there are other ways to be good and make the class more active. So first approach is to have small group discussions in the classroom. That's not easy to do if you have a class of 150 people. You want to divide it, which I often do. But if you have a smaller class, 20 people, or a journal club class, that works very well. And so that's the first thing on the list. Second thing on the list is to have student take-home final exam projects with abbreviated summary presentations by project groups to the entire class. I teach a class I've been teaching for many years, large classes. And how do you give a final exam that's a take-home final exam to a large class and worry about grading? And how you going? Well, I figured that out. And there are different ways to cut things short in terms of how you spend your time. But it's very important because what this whole topic or this whole category is dealing with teamwork. When you're doing when you're talking about take-home final exams, you're talking about having people work together in groups, and they have to do it together. Now, they can get help from your TAs, but if you don't do something like that and you just have them take in-class exams by themselves, you're missing something. Peer instruction or peer approach. Now, this is just basically saying that somewhere in the course, depending on how large the class is or how you organize the course, you want to have students teaching other students or students communicating to other students the material in the class. If it's only you, the instructor, doing it, there's something missing. Okay, so that's the third thing. And the fourth thing, there's a fourth thing, is there's another approach to teaching that I've never done, but it's called the flip approach. How many know about that? How many have used it? I thought I knew enough people. And whether that works or not, those who raise their hands probably would say it works because they're using it. But basically, it's doing something a little bit different because the usual traditional approach is for homework, you give exercises to students, exercises that based on material you've already covered, and then in the class, the next class, you cover new material. But in the flip class, you give them the homework assignment is to read the material you want them to try to understand, and in the class, you actually do exercises, and that creates, again, more teamwork and more discussion within the class. That's the second one. Third one is provide mechanisms for reinforcing learning outside the regular classroom, okay? Other mechanisms. First one is basically to have, particularly for large courses, but doesn't have to be for large courses, to have higher level students as teaching assistants. You need teaching assistants, and what this does is it allows for lab sessions where you have smaller groups, so you can have individual communication, and you also want to put in office hours, so individuals can meet with individuals. And the faculty wants to have office hours too. Second thing is learning management systems. I don't know how many of you use Blackboard or Canvas. These things are extremely important for getting your course organized, not only at the beginning for you, but for your class throughout the semester, so they can see every bit of material that you're giving them as an opportunity to learn. material you've taught, that might be extra things you want them to learn. So learning management systems, those are two of them, and I've been using Blackboard for years. We now use Canvas at Emory, but I'm retired, so I'm not using Canvas. Lecture recording videos. When we built the School of Public Health second building, about 10 years ago, all the classrooms had video recording systems. That wasn't true way back when, but I've always recorded all my classes, and I take the recordings, and I immediately, as soon as they get them, I put them I put them on Blackboard or whatever it is, and so that they could review it. Now, some people don't even go to class, and they want to just use the recordings, but going to class and reviewing the recordings is even better. So that's another thing. And the fourth thing is distance learning, which is another approach that doesn't really even have a specific classroom. The classroom are people from all over the world that take a course. Now, different distance learning courses do have parts of them sometimes where they do have to meet in a classroom, but a lot of them don't, especially if they're coming from very wide parts of the world. So these are four approaches for mechanisms for outside the classroom. And of course, another one that was mentioned to me yesterday that I didn't have on the list was going out into the community and doing your class in the community. You have a class, but you actually don't necessarily do it in a classroom. You actually go different places. That's not on my list, primarily because as an instructor teaching statistics, I don't necessarily need to go out to the community to do that. I just need to get my message across. And then fourth thing is to incorporate multimedia instructional materials to promote active learning. I mean, that's something that I've spent a good part of my career doing, and what I first say that is from classroom Blackboard to overhead transparencies. This is the history of what, originally when I started teaching in the 70s, in the early 1970s, all we had was Blackboard and a chalk. We didn't have anything else. And so there's a picture of me on the bottom that's teaching my class where I'm writing everything on the board. And well, I mean, if I'm good at it and I'm good at explaining things, that's fine. But it's not easy to do, and it's not easy to read. So, and there are better ways to do that. And I spent a lot of time thinking about better ways to make things more active. Also, overhead projectors were also used. You're giving me a warning. Okay, so let me go fast here. Multimedia approach for teaching probability using transparencies. I started, my first multimedia effort was to do something where probability was such a horrible topic to teach that I tried to make it fun by using some very colorful and new ways of approaching it. Second thing I did in the 1970s was develop slide tape presentations to teach beginning biostatistics topics that students could actually go to the library to learn rather than have to learn from me directly in class. And these things are now converted to PowerPoint presentations, which are now available. And the fourth thing on the list, the fourth thing on this list is the first two textbooks, the second and third textbook I wrote on logistic regression and survival analysis were textbooks that were written in PowerPoint form. Slides on the left, text on the right of each page. Before PowerPoint, there was no such thing as PowerPoint. So I had sort of the idea of trying to do something that would have that thing. So it was before PowerPoint. And lastly, actually develop some very fancy multimedia ways of teaching, and that's what Lloyd mentioned. Active Epi, the first multimedia epidemiology textbook that's available free. Over about 10,000 people use it. It's in over 100 countries, and it's something that's very appropriate for people learning public health. And it's free. Doesn't cost students anything. Talking about high schools and undergrads, doesn't cost them anything. Doesn't cost the teachers anything, and it's good because I did it. No, but anyhow. So that's the four things. 1, 2, 3. 4, and so I'm done.
Thank you, David. Next, we hear from Nancy Kane.
Thank you. Good morning, everybody. I am not going to use PowerPoint slides, partly because it's against my teaching approach. partly because Harvard has done a lot of research now on adult learning, and one thing we've learned is that PowerPoint slides make you talk faster. And students, it turns out people in an audience usually understand about 20 words a minute, and PowerPoint gets you up to about 120 words a minute. So even though you do have the slides later and you can look at them, and that's probably the benefit, to the topic that we're in today, which is active learning, I try to not use PowerPoint slides. I try to engage people in the learning process in more discussion-based ways. So cases are just one vehicle of many, and I think my colleagues here will be giving you, already started to give you some of the other vehicles you can use to engage students. But discussion of a problem, of a public health problem, is one of the ways you achieve the benefits of active learning. So, what are some of the benefits? We talked about some of those in the earlier session, but when students are highly engaged, they retain things a lot longer. And they talk about them after class, and they're excited. And I get emails 5 years later saying, "Remember that case we did? That was very helpful to me today in my job." So it's been shown to be very, very effective case-based active discussion learning for students for lifelong learning and retention of the knowledge, and more important, the skills that you want them to learn. And I think someone mentioned in the first session that knowledge is fleeting. It's rapidly changing. So if you spend your educational time teaching them just knowledge, that's not going to be relevant 10 years out. So you really need to teach them how to learn. Not so much what the knowledge is, but how to acquire the knowledge, how to assess the knowledge and critique the knowledge, particularly today when knowledge comes from so many different places, many of which have dubious origins and intentions. So the skills of problem solving, of communication, of critical thinking that Donna mentioned, I think, and those are all skills that you can push on with case-based discussion. A student can say something, you can challenge them to say something a little deeper. Another student can challenge them to say, well, I don't understand what you meant by that. And that process is an incredibly valuable learning experience for students that you just can't create when you're the sage on the stage and they're the passive receptors of your pearls of wisdom. The bad news, it's hard to do. It requires not just a curriculum that has cases, but although that is actually less of a problem, the biggest obstacle is the faculty themselves. Many of us did not learn through discussion. We learned through passive learning. Many of us are used to being the expert, and it's quite terrifying to give up being the expert and hoping that the students will play their role so that they can actively engage in the discussion that you have at hand. There are three key skills to teaching, leading a discussion using cases or articles or whatever problem, however you want to present the problem. Learning how to ask good questions. Boy, is that hard. So many of us just want to ask them factual questions. What's in the case? Tell me what the knowledge is in this situation. What you really want them to be doing is saying, what did you think of what's in the case? How do you evaluate the situation? What would you conclude about what the protagonist in the case should do and why? That's much higher level on the Bloom's taxonomy of questioning than what many faculty revert to, which is sort of factual because they kind of know that they can get an answer out of somebody eventually. So you have to ask a question that's a higher level question, and you have to actually let students think about what they're going to say, which means you ask a question and you count to 10 and there's silence. Terrifying, terrifying. The other thing you have to do is listen. And that perhaps is even harder than questioning. Listening to what people say in all kinds of accents and languages and reference points is very, very challenging. Getting to know your students, not only their names, a little bit about their backgrounds, so that you can actually help them put their comments into the context of what you're trying to get students to learn that day. That's probably the hardest part. And frankly, it puts me back on a blackboard. I use the blackboard as a framing device for taking what I hear and putting the key points that the students are saying on a board. Now, there's other ways to do it, whiteboard, and there's some kinds of things I haven't mastered yet that are that require more skills than I can achieve with my eye-hand coordination. But it's really important to find a way to listen and record and eventually have a way to bring it back as a learning opportunity for students. And the response part, so it's listening and then responding either through your body language, through your recording, through your continuing questioning, so that there is a real ongoing conversation there and not some kind of answer my question and we'll move on. Because that actually makes it a less friendly and less open learning experience. The other part that's hard, besides faculty performance, is the your expectations of what the students have to do. So the flipped classroom is actually the underlying theory of the case-based teaching. Students read the case in advance and come prepared to talk about it. You may be giving them a few questions to think about while they read that case. You don't want to overload them with readings because you want them to think, not just read. You want them to come having thought about. And that's a preparation that many students just aren't used to. They're used to listening to you go on and on and on for your 90 minutes, going home, reviewing your tape online, and coming back and listening to you for 90 minutes. And when you say, no, you come to me, I'm going to ask you questions, and you are going to provide the learning in this class, freaks a lot of people out. So you have to set that climate yourself. You have to set those expectations. You have to start because not everybody's doing this method in my program, I have to set the expectations on day one of my class. You know, what's a good discussion? How are we going to grade it? And I make my students grade each other on how the discussion goes as a group, and every day I remind them they have to come, which is hard for many. They have to come prepared, and they have to speak up. I don't care how shy you are. I mean, I give them all kinds of ways to do that help relieve the pressure, but you've got to get over this thing, well, if I'm shy, I shouldn't have to talk. So those are some of the things that are hard to manage, I think, as well. And how am I doing? I have my time up button flying at me too, but I think he got some of my time. So I guess in sum, I just want to encourage you, I think, and I do a lot of this, faculty do need training in this. You can't just pop them in there and expect them to succeed. Don't be afraid of failure. If you don't, you will only get better with practice. It's one of those skill sets that doesn't come naturally. So let your faculty, invest in some faculty teaching training, even if they're senior, and do some peer collaborating around that and observing, and you will be able to get this kind of experience in your classrooms if you put the commitment in and you reward faculty for doing so. And the students love it. Thank you.
Well, I did the case method training with Nancy, and I am using slides, so clearly I need to come back for more training. So I'm here representing myself and James Wolff to talk about practice-based teaching. Just by a show of hands, who here engages in practice-based teaching, otherwise known as service learning? And just keep your hands up for a second. Put your hand down if you use a framework. So a lot of you do practice-based teaching, but with no framework. So that's what we're going to talk about today. And green button. So practice-based teaching is essentially the collaboration between a classroom and a community partner, and it's a mutually beneficial dynamic for all the stakeholders involved. So for example, for students, what practice-based teaching allows is the ability to enhance their technical knowledge, which is required by the competencies of the course, but in addition allows them to gain professional skills and workplace skills that otherwise are not achieved in traditional learning classes. In addition, they can really enhance their professional portfolio. They leave the semester with a really solid quality piece of work that they can show to potential employers, as well as also helping clarify their career goals because they've worked with an agency. For the agency, they achieve really high quality deliverables in a 14-week semester. And for understaffed, under-resourced public health agencies, this is essential. They also really get innovation infused into the problems that they've been struggling with for sometimes weeks, but sometimes years. As we've heard, our students today are in a different environment than a lot of our public health agencies were trained in, with technology and communication. And so the students can really infuse a lot of the problems that we're faced with today with a lot of innovation. For faculty, it really allows for an enhanced experience, which can be problematic and troublesome sometimes, because as faculty, we enter the classroom really armed with what we know and ready to teach that. And I can say that there's very few semesters where actually the problems that my students work on or that Wolfie students work on are problems in our areas of expertise. So while it's a little, you lose control of it, but it's also an enhanced expertise. And all of this comes together and really creates a dynamic classroom with enhanced learning abilities, great collaborations, and a depth to what the students produce. It's all helped by the alumni network. We rely a lot on our alumni for collaborations and for reporting back about the types of problems in the field that our students should address. And at the end of the day, it does address the mission of our schools of public health. So we do all this absent a framework. So Wolfie and I came together. Wolfie represents a global perspective. I represent a domestic perspective, and we come from a lot of years in public health consulting. And what we did is we developed a framework for practice-based teaching, because for faculty unfamiliar with how to do this or schools unfamiliar with the resources involved, the lack of a framework can make practice-based teaching pretty daunting. So practice-based teaching relies on this foundation of course design, which is very similar to how we develop courses, traditional courses, but with the added benefit of things like professional development, professional skills, workplace skills. These students consult, they're the consultants for public health agencies who are the clients over the course of the semester, and because of that, and because of that face time and that real hands-on approach, they need to have the ability to interact with their clients. Once you find clients and you establish scopes of work, you can then move forward into the steps. So as you can see, each step is STEPS. So step 1 is in securing partnership for PBT. This can take 4 to 6 months. This can take a year. But once you secure a partnership for PBT, which means you find an agency that has a problem that your class would be well suited to address, and the deliverables from your class that the students produce would benefit the agency, then you have a really solid connection with an agency, and you can move forward, and you can move forward with them collaborating with you for the class. You then think about a scope of work, what the students should address, and what the problem is that the agency wants solved. And in a semester, you can have multiple partnerships with multiple agencies. Once you've established that connection and that scope of work of what the students will work on, you then move to step 2, which is technology and training for practice-based teaching. Because communication is so essential to the success of PBT, having streamlined mechanisms and technologies in place to allow all of the stakeholders that you saw from the first slide to engage with each other is essential. And this is where step 2 comes in. So once you have all of that in place, then you can actually engage with your partners and with your stakeholders and implement practice-based teaching. And again, communication is key. This requires 360 reviews. This requires agency feedback, both to the faculty on how it's going and to the students on the utility of the products that they're producing throughout the semester. It also requires really great communication between faculty and students to understand, are the student teams working well together, what pieces of skill development are lacking still in the course that the students need. So practice-based teaching is not about content. It's about arming students with the skills that they can apply across content areas. The 4th step is presenting the deliverables. So at the end of the semester, how do the students give back to the agency? Wolfie and I do very similar practice-based teaching where the students have connection with the agency throughout the semester, and that looks different for both of us. My students meet face-to-face because I work domestically, and that we're able to do that. Wolfie has global clients, and so it's a little harder for them to meet face-to-face, but they still interact with the agency in other ways. So presenting deliverables in terms of written products, consulting reports, implementation plans, strategic plans, intervention design, whatever it is that your class students produce, in addition to presentations, whether those are in person or pre-recorded or virtual, are really important. And it's especially important because it allows the agency to invite their stakeholders to that final presentation. So the students can say, this, we heard you, this was the problem we heard, this is what we're giving back to you that you can implement in your communities. And for a lot of our stakeholders who are one-on-one with the student groups, the ability to expand their network into their agency and invite their stakeholders to these final presentations helps with adoption and implementation of the products that the students produce. And then the 5th step, which is near and dear to my heart as an evaluator, is sizing up the results of the collaboration. And as we know, student evaluations are typically what we rely on to know if a class is working, which is faulty in itself. But for practice-based teaching, it's especially faulty because we don't just deal with the students. We work with agencies. We work with the communities they serve. So ideally, we want to know, did this collaboration help the student obtain a job, enhance their professional skills? Did it help the agency address the needs in their community, and how did it do that? And that requires a larger evaluation than just a student evaluation and a longer-term evaluation. This is all supported and enhanced by the school, faculty, students, alumni, agencies, and the communities that the agencies serve, and the whole process of PBT steps is supported by this. So it's resource intensive to do PBT for sure, but the benefits far outweigh the costs. And as we've heard a lot this morning, arming students with skills is really essential. These are some ways that sustaining PBT collaborations seem to us to be the most appropriate, things like enhanced resources, institutional support, the time and the energy, and the interest from schools and communities to hear what students want to produce and have to produce, and then following up accordingly with the agencies to make sure, was this useful? Was this a useful collaboration? Because if it's not, then we need to change it, and if it's not, then it affects your partnership in subsequent semesters. Thank you.
Thank you. Thank you. Well, we have 3 minutes for 3 questions and 3 answers. I'm going to start with Nancy. I was talking with Nancy prior to this session, and she said that case-based teaching was something that has been long used in medical schools, but has been slower to get rooted in public health education. And I was wondering if you could comment on that. Do you see this as a trend that's happening now?
Yeah, I mean, oops, I think I'm on. Yes, yes, increasingly. I mean, we've been running a case-based teaching seminar for public health instructors for about 5, 6 years now. People come from all over, 50, 60 people a year, and that's great just to see that amount of interest. And I think the new STEEF criteria have really helped mobilize the people who want to learn this technique. So yes, it's definitely expanding.
And good short answer,
Let me
Jacey.
just add something that, as you said, it's the flip approach is what you're doing.
Right.
And this is an example where if the problem is you have to develop those cases in a way. It takes a long time to develop them correctly in order for this to be able to work. If you can do it, great.
Jacey, how do you motivate your practice partners? Or
Hand it over to
James,
Wolff, since I took the
right,
heavy
Dr.
lifting
Wolff.
with presenting.
Thank you, Jacey. So I think that's a very good question. I've had clients that I've been introduced to when I've explained the process of working with them and what the students are going to do for them and preparing the scopes of work. Their question always is, how much is it going to cost? And I'm happy to always tell them it doesn't cost you anything. This is a partnership that we're doing together. And I think as soon as they realize that, they become really invested in the work that the students are doing, and they become fabulous mentors to the students as well as providing them an opportunity. One of the interesting things about this kind of teaching, and all my courses, we work virtually with organizations all around the world, is that the students often find opportunities after the class is over to actually go and do practicums or do work with that organization. We have 2 students that are going to India in a couple of months who are working with an organization in India that we're currently partnering with. So I think it's a very expansive and kind of useful way to connect and to do something in the community while working in the classroom. I think that's the whole point.
Thank you. David, one of the things that I learned from your presentation that I never thought of using was a team take-home exam. So I was always concerned that with this team exam that there was somebody in that team that wasn't pulling his oar or her oar. So was that a concern of yours?
Well, that's always a concern, but one thing I do is the class doesn't have only a take-home final.
I see.
It has at least 2 or 3 other in-class exams.
Right.
So the grade counts a
right.
combination of those. It's sort of a weighted average.
Right.
And it's true, somebody could overdo it in a group,
Yeah.
and that can happen, and I can't prevent that, but that's true.
Good. Well, Fortunately, we have a break coming up so the audience can grab a hold of these panelists who've certainly done a great job.